Good afternoon. Welcome to the Promoting Self-Advocacy and Self-Determination in Oral Health Setting. This seminar is being presented by the ATSU Arizona School of Dentistry and Oral Health on September 25th, 2019. Advocacy for individuals and caregivers. I'm Dr. John W. Day. I'm an orthodontist in Tucson, Arizona. I have a private practice in Tucson, and I am a member of the Children's Clinic and Rio Community Health Center. In speaking of advocacy, advocacy is an activity by an individual or a group that aims to influence decisions within political and economic and social systems and institutions. What is the role of advocacy? Advocacy offers an independent support of persons that feel that they're not being heard. It ensures that they are taken seriously. Advocacy allows persons to understand informational content and respects, defends, and safeguards one's rights. Advocacy permits persons to access the appropriate services that they need. Advocacy is not the abdication of one's personal responsibility for oneself, nor is it the transferring of responsibility from yourself to another. Advocacy is not about your wants, and it's certainly not about whining until you get what you want. As we speak about self-advocacy, self-advocacy is a form of advocacy that provides the ability to speak for yourself, the ability to describe things that are important to you. Self-advocacy means you can tell people about your thoughts and feelings, and you can ask for what you need. The features of an effective self-advocate are certainly knowing oneself and knowing one's needs, knowing how to acquire one's needs too. As we relate to medical and dental facilities, advocacy becomes an important part in our interaction with medical homes and dental homes. This is our children's clinic in Tucson, Arizona, which I'm associated with, and some of the hints in this presentation come from my experience of the many years of working with dental and medical patients. Reflect and write down the needs in your notebook. Prepare your questions as you would go along and record them in your notebook. Gather details about the provider services that you need and locate the provider contact information. Additionally, in your notebook, place your personal and contact information. Attach copies of your insurance eligibility documentation. List any prescription medicines that you take and reconcile them appropriately. Record in your own words a medical history about yourself, and record a dental history about yourself too. List any primary care physicians that you visit. List any specialty or complementary medical alternative providers that you visit too. In your own words, record your family and other histories. In your notebook, write the most recent and past visits, any problems or surgeries that you have received, any supports, or your feelings about the outcomes of these visits. Make notes for your providers in your notebook. Let them know things that would be helpful to them. Do you have a preferred language? Do you use a preferred pronoun in your identity? Do you have a time of day that you are best? Do you have access to transportation? Do you have limitations? Do you require assistance or accommodation? In addition, let your providers know that any information that would be helpful for them in providing your health care. Let them know that you're bringing someone for your support, and please describe the type of support that this person provides for you. Things that will help them become more comfortable in providing your care. Make your first contact by telephone. As appropriate, you may contact the professional office by email. You may even appear in person in the office and schedule your first appointment. Tips for an experienced self-advocate. Coach your questions, your comments, and your replies in your preferred language. If you require interpretation services, please ask the office to provide that for you. Be mindful of the person providing the interpretation services. Good manners and courtesies are noticed. A please and a thank you go a long way in your conversations. Pointers in becoming a self-advocate: it's okay to ask help from others. It's okay to be humble and appear vulnerable to others. It's okay to join in collaborative discussions with your peers, your providers, and others. In closing, reflect on the thoughts in your notebook. It's a continual process to keep the notebook current and add new ideas to it as each medical or dental visit goes by. If you're seeking particularly specialty services, the notebook would be very helpful in bringing your medical history and your dental history to that new provider. Make the call. Included in this slide are a number of resources for the self-advocate. On the national level, the ADA Library for Oral Health Literature for all ages at mouthhealthy.org is available to you. In the state of Arizona, the Department of Office of Oral Health and the Arizona State Dental Society are very good resources for dental information and dental services. Locally, you may find the ATSU University in Mesa, the Rio Salado Dental College in Tempe, the Rio Health Center in Tucson, the Marana Health Center in Tucson, St. Elizabeth Hungary Clinic in Tucson, and the Pima College Dental Hygiene Program also in Tucson. This concludes the presentation.